Hello, in this video we will discuss about the pathophysiology of eyes. We will discuss about related to the vision, visualization, and there are many complications which that can be disorder or deficiency due to the nutrition. And we will also understand about food which contain rich amount of vitamin. So here is the first of all we will understand the structure of the eye. Here is the layers of eyes: sclera, choroid, and retina. Choroid is the middle, while the sclera is the outer and retina is the inner most layer, which contain a macula. In the back side, the make fovea due to the rod and cone cells. So remember, and here is the iris. Iris is basically used for the coloring of the eyes, while also inside the pupil, which that is used for the dilation and constriction due to the iris contains ciliary muscle. So here is the inside is the lens used for the light absorption on the basis of their changes angle, and here is the vitreous humor. So cataract is the basically is the cloudy part of the eye lens, and it is create a blindness, and worldwide it is the famous cataract, and that is basically it can be cured by surgery, but depend. So here is the optic nerves as well as other things. So here is the refractive errors can be through a lens will not completely concave or convex during the sighted. For example, here is the normal, distant, and close vision can be make a image into the retina is easy, but this is the myopia in the nearsighted problem due to the a not complete image formation in the retina, while the hyperopia is the basically a long sighted, and we can fix that the mirror through glasses, for example concave and convex. Convex is used for the myopia, and hyperopia is used for the convex lens. So here is the rod and cone cell, which that is make up of macula or fovea, make fovea. So it's contain photoreceptor, rod and cone cells. Rod cell is used for night vision. So rod cell is used for night vision, and cone cell is used for daylight. So the produce color. While the rod cell is very big potential and high potential for absorption of light. So that is why night time. So the retinitis pigmentosa is the another complication or disorder is genetically, and rod cell degeneration lead to night blindness. So the hyperpigmentosa is basically increase, and incomplete pigmentosa can be before the age 20, but it can be progressed to become a hyperpigmentosa. So the age-related macular degeneration mean the decreasing of the damage the sharp and central vision, and due to the decrease the rod and cone cell, and it can be wet abnormal blood vessel behind the retinal start to grow under the macula. Ultimately, blood and fluid leakage will create the blindness, while the dry type is that the macula thin, and thin macula due to aging, so the blurry vision will be occur. So remember, macula make fovea, and more fovea is contain a rod and cone cell for light detection. So, diabetic retinopathy is the important next topic we will discuss. It can be a microaneurysm. Microaneurysm mean the leakage due to the bursting of vessel, but little bit. But the blockage in some retinal vessel due to the angiogenesis as well as the leakage and bursting. And on the other hand, the severe non-proliferative and diabetic retinopathy. So here let's begin to understand. This is the pancreas producing insulin, and insulin go into the blood circulatory system due to the response of high blood glucose, and after this it will be bind with the glucose cell, glucose taking cell. So the glut channel will be open, and after open the glucose will be enter, but normally, but abnormally the insulin receptor will be damaged, and the no more glucose will be enter, so the blood glucose will be hyper glycemia and hyperinsulinemia. After this damaged blood vessel lead to be blind. so the blind due to the leakage. And on the other hand, that's blood circulatory system will leakage, and this is a closed circulatory system and not require the bursting of the vessel, but it will eventually burst due to the hyperglycemia and high blood fluid due to the high blood pressure and artery damage, and will create the blindness due to the less nourishment of the rod and cone cell due to the bursting of the blood vessel. And when bursting of the blood vessel, that content the scar tissue formation in upper part of the macula will blind, and that is why the light will not absorb too much. So that is. On the other hand, the glaucoma, that is, glaucoma is the open angle can be or closed angle optic nerve. So the optic nerve will be damaged here. So after the optic nerve damage can be open angle glaucoma chronic condition that progress slowly, but the closed angle glaucoma can appear suddenly and painful. So it can be recoverable because the alarming about the pain, and we can check in the doctor regularly to cure their condition, but that is another thing. So here is the amblyopsia, is the lazy eye, when brain and eye less coordination due to the oculomotor nerves and optic nerves will not interconnected too much, and there are many reasons nervous disorder which that is lead to amblyopsia. So let's begin to understand about the vitamin A deficiency, and there are another vitamin deficiency. So this is the inner membrane of the rod and cone cell and outer membrane. Inner membrane is stack-like structure. So used for the light absorption. Here is the opsin will bind with the 11-cis retinol vitamin A type. After this binding during the light time to form a rhodopsin. This rhodopsin will activate trimeric transducing protein which contain alpha, beta, and gamma subunit in the form of inactivate activate to activate by GTP. Alpha subunit will be separate to activate via a phosphodiesterase enzyme. Is here is that trimeric subunit, and activate the cyclic GMP to convert the GMP will inhibit the sodium influx while the cyclic GMP will promote. So hyperpolarization will be occur due to the outflux of the calcium and potassium, and in this way the light will be detected by this mechanism. So this is the molecular pathway, or you can see that. So on the other hand, here is the GMP which that is converted into the cyclic GMP in the presence of the guanylate cyclase enzyme. So the again will be converted into the cyclic GMP will promote the sodium influx during the without light. So it will be hyperpolarization will convert into the normal polarization. Remember about these things. So the vitamin A deficiency, why? Because the 11-cis retinol will bond with the opsin to produce a rhodopsin is used for the light detection. So the blindness will be occur due to the vitamin A deficiency. Remember about that things. And risk of vitamin A. Remember one more thing. If the vitamin A deficiency, but the rod and cone cell will be normally functional, so the blindness can be decreased. So the risk of vitamin A is the pregnant woman, the breastfeeding female breastfeeder, and the infants, children, cystic fibrosis, chronic diarrhea, and nutrition effect, and malnutrition. So that is all things due to that. So remember that the vitamin A supplement can be used for this mechanism. And vitamin C is also important. Why? Because the vitamin C is an antioxidant that is highly concentrated in aqueous humor, which that is the fluid-like structure are present into the inside of the cell, inside of the eye, directly linked to the dietary intake. So the dietary intake of vitamin C is very important for eyes as well as skin, but here we will understand about the eye. So the vitamin E is also the fat soluble, but vitamin C is not fat soluble. So it will not store in our body. So the continuously vitamin C is required. While the vitamin E and vitamin A is not continuously required or gradually or even every food is not required. So the protect fatty acid in the eyes from free radicals and unstable molecule. So in this way the eyes will be managed their function due to the vitamin E. And the zinc is also important trace mineral, which the zinc is an essential minerals in the retina and the vascular tissue, and that is important and also used for the function. So let's begin to understand how to use the dietary plan for adding the vitamin A, C, E and zinc containing food in the daily basis. So the food which contain rich amount of vitamin can be vitamin A, vitamin C, vitamin E and zinc. So remember, you can match this all food which that is contain the same things and the best for eye health, for vision. So the fish, liver, dairy, carrot, spinach, kale, sweet potatoes and broccoli. That is the vitamin A containing food. And vitamin C is the bell pepper, citrus fruits, kale, broccoli and guava. On the other hand, the vitamin E can be the tree nuts, peanuts, sunflower, seeds and vegetable oils, green vegetables. And the zinc can be a red meat, poultry, oysters, beans, whole grains, dairy products. These all things is related to the food which contain rich amount of vitamin, which that is used for the cure of the eye vision. But the disorder is a separate things which that is unable to recover on the basis of the condition. So thanks for watching. That was the pathophysiology of eyes and their disorder as well as cure. Thanks. Bye.